My first question to you was, what are milk teeth? And can you explain more about milk teeth?
See, funny you asked. I think we should start our conversation with this question, because this is the question which I have heard so many times. When I was studying pediatric dentistry, that was the first thing which was explained to us, that parents are going to ask you this question and how you should explain what is importance of milk teeth. Milk teeth basically start coming in the mouth, erupting in the mouth around age 6 months, and complete their eruption by 3 years of a child's life, and then they are there till 6 years when they start falling. This falling of milk teeth and erupting of new permanent teeth will continue from 6 years of their life till 12 to 13 years of their life. So all major growing period of a child, they have milk teeth, and which will be then replaced by the permanent teeth. And as I said, these are growing periods of child's life. So that means if milk teeth are healthy, they will be able to chew better. They have good quality of life. They do not have pain, swelling, all these problems. And the growth and development of their jaw also goes normal. So that is the importance of having milk teeth.
Why do we have milk teeth first? I mean, what's the reason? Why don't we straight have permanent teeth?
Well, if you see all the animal kingdom, this is what the rule is. The milk teeth will do come first, they fall, and the permanent teeth.
So what happens if the milk teeth don't fall and the permanent teeth start erupting? Then what can parents do for kids?
As I said, about 6 years of age, the lower front teeth, the bottom front teeth will start falling, and the permanent teeth, bottom permanent teeth, are placed naturally behind the milk teeth, front teeth, and therefore many times before the milk teeth are loose, they can be kept as they are, and they will fall on their own. If they are not loose, then they need to be removed, so that the permanent teeth can adjust themselves in the proper place. See, there is normal variation always. Even if I say that they start falling at the age of 6 years, I have seen so many children who are 5 years of age and teeth have started falling. And I have seen so many children who are 8 years of age and not a single tooth has fallen. So there is some normal variation, but at the same time, if this is happening, they need to visit, the parents have to take children to a pediatric dentist or a dentist, so that a cause can be found out. And sometimes x-rays have to be taken, sometimes general health of the child has to be taken into consideration, and depending on that, the treatment line can be decided.
So when should brushing be started for children?
According to recommendations, at the age when the first tooth begins eruption, brushing should be started.
My God.
Yeah. That early, and even before that, if not brushing, at least the mouth should be cleaned. The child is feeding, there will be milk curdle in the mouth, and therefore that has to be cleaned for a small infant. So brushing needs to be started at the age of 6 months when the first tooth begins eruption.
Wow. And when should children learn to do it by themselves?
So when at that time, at this age of 6 months, when the brushing is started, it can be, you get baby toothbrushes in the market, so you can parents can start brushing with a baby toothbrush. You get silicone toothbrushes in the market. These are baby toothbrushes, and they are very soft. So brushing without toothpaste also can be done initially. As the child is about 1 year of age, they start getting their molars, the grinders, and at that time a toothpaste should be introduced. At this time, toothpaste should be very small, in small amount, which is about just a small smear or a pea size, you can say, and with that toothbrushing should be done by the parent. When this brushing should be continued by parent till the age of 6 years or 7 years.
Oh.
At that time, children can be asked to brush. Parents should supervise brushing for some time because they are still not skilled to brush properly, and then slowly children will learn and brush properly
by themselves.
by themselves.
Okay. All right. Another question that I wanted to ask you is, most of the kids are bottle fed. So how long, like they feed, they drink the milk from the bottle and they go off to sleep, and they don't rinse their mouth and all. So how does that impact? Does that impact the child?
Yes, it does cause cavities. Breastfeeding or bottle feeding, both are bottle feeding more, are seen to cause decay if the child is fed during night. Many parents, as you said, have a habit of giving bottle or breastfeeding during the night, and for several times at will breastfeeding is done. According to recommendations, till 1 year of age, till 6 months of age, the child has to be breastfed exclusively. After that, supplemental food needs to begin. And after 1 year of age, the breastfeeding or bottle feeding should stop. The night feeding I'm talking about should stop. During daytimes, they still can breastfeed. World Health Organization recommends breastfeeding till the age of 2 years. So till then it can continue, but night feeding should stop at the age of 1 year. 1 year because at that time most of the incisors, the front teeth have erupted. Some of the molars are still are coming in, and therefore this is the age, and child is eating more. Yeah. So this is the age when night feeding should be discouraged.
And if the child continues to suck through that bottle, does that impact the development of teeth also?
Sucking on bottle, if it is done for a long time, then yes, teeth are malaligned in that situation. But moreover, it will cause dental decay. Okay. And you can imagine at that age, if the child develops decay, the child is going to have this decay is going to progress, and child will start having pain, will have other consequences of decay. At the same time, treatment of this child is going to be difficult at this young age. So as much as possible, this should be prevented.
Okay. I wanted to also ask you, mainly many kids, who we work with as in special need kids, like I'm sure majority of your caseload also is with special needs kids. They have oral motor issues and they don't allow brushing teeth. It's so sensitive. So what is it that parents can do? Finger brushing is okay, or what can be done so that, and if they have cavities, then many a times it's recommended that they go for general anesthesia and get the treatment done. But parents are very scared. So would you throw some light on how to work on with that?
Various children with special need have sensory motor disorder, especially as related to oral cavity, and therefore they have problems brushing, they have problems eating different foods. In these cases, parents need to introduce brushing slowly. I have seen in my practice that children who have such problems gag more when toothpaste is used, and therefore initially parents can use toothbrush only, maybe only on the front teeth. That is how it should begin. Only on the front teeth. As the children start accepting toothbrush in their front teeth, they can slowly move towards the back teeth. Slowly they can start opening the mouth and then brushing.
And this applies to anybody.
Not just children. And many children at that time, many children would be distracted with storytelling, with singing songs. So that the parents should make more efforts to see if the child is comfortable, is distracted a little, so that brushing can continue. And initially, as you said, maybe they can do finger brushing, start brushing with toothbrush, slowly introduce the toothpaste, only front teeth first, then back teeth, and slowly they can graduate to brushing twice in a day with a toothpaste.